So the Institute for Resilient Health Systems is a network of multidisciplinary researchers who are really working on health policy and systems research with a particular focus on health systems resilience.
A resilient health system can provide a good quality of service regardless of the circumstance, equitably to people so that everybody has the opportunity for health, and it can carry on just delivering its sort of minimum critical functions even in the middle of a shock or a crisis.
So unfortunately, shocks and stresses are on the increase. So shocks in terms of violence and conflict and protracted conflict, pandemics, infections, earthquakes, all of these are happening all over the world. And that's in the context of chronic stresses like poverty, rising costs of food and fuel, of antimicrobial resistance, of political unrest.
It's the community, it's the physical infrastructure, it's the supplies, it's the funding. How do you get the funding right in a crisis to make sure services are being delivered? It's prevention, it's public health aspects. So it's all building blocks of the health system, but within that community and within the bigger picture of how the government is running that system.
There's a couple of projects that we are working on at the moment. The first one is Rebuild for Resilience, which is a 6-year programme funded by FCDO, and it really focuses on the capacities of the health system to be able to respond when shocks happen. And this is happening in really fragile settings of places like Nepal, Myanmar, Lebanon, Yemen, Tigray, Sierra Leone, and other places as well. So this is a 6-year programme. It's coming to an end at the moment, and we've developed a vast body of knowledge about resilience capacities of the health system. We've got lots of other programmes, but another one is called Thrive, which is looking at the impacts of climate crisis, so sort of climate events, on the health and well-being of marginalised populations within Malawi, and that's really focusing on fishing and farming communities in Malawi.